Hi, this is Raina, and I'm going to be presenting today on the Frazier Free Water Protocol, or the Free Water Protocol. What is the Free Water Protocol? It's a therapy modality that can be used with patients who suffer from severe dysphagia. The Free Water Protocol therapy allows patients with dysphagia to drink water within very specific parameters. Who are typically candidates? Typical candidates for Water Frazier Protocol suffer from severe levels of dysphagia. In order to participate in this therapy modality, patients must be able to stay awake and alert throughout the entire session, be cognitively capable, have adequate sensation throughout the swallow, and have adequate muscle strength and control to bear down and cough, as well as sit up. How is Free Water Frazier Protocol conducted? Before starting the session, it's important that the patient completes a rigorous oral care. The clinician should then provide a cup of cold water and determine if the patient meets physical and cognitive requirements to perform a therapy session. Next, the clinician would ask the patient to make a series of sounds in order to ascertain a baseline voicing sound. Now, the patient may take a sip of water at the cue of the clinician. The clinician then will cue 2 hard swallows, watching for hyolaryngeal elevation. Once the swallow is complete, the clinician will prompt the patient to make an ah sound and listen for vocal wetness. The ah sound is going to be more like ah, kind of, you can use the prompting of ah, the crowd goes wild. It's just so that you can really hear if there is any wetness in the voice. If vocal wetness is heard, the patient will be instructed to bear down and cough. This will be repeated until there is no longer wetness within the vocal expression or the session is terminated. If no vocal wetness is present, the clinician can continue and cue the next swallow. How is it conducted? It is also important to perform proper oral care after the Free Water Protocol. And the Free Water Protocol cannot be performed during meals. The second that a patient takes a bite of a meal, all Free Water Frazier Protocol needs to stop. A minimum wait time of 30 minutes is required after meals. Water should be ice cold and thin. Who can conduct it? Free Water Frazier Protocol can be conducted by anyone who has been trained and approved by an SLP. The following people often perform Frazier Free Water Protocol: caregivers, aides, family members, SLPs, and more. What evidence supports the use of the Frazier Free Water Protocol? Numerous studies have been done that support the use of the Frazier Free Water Protocol. Studies concluded that the protocol does not contribute to aspiration pneumonia. Patients also reported an overall increase in their quality of life. What are the expected outcomes? To improve the quality of life for patients who are NPO, avoid pneumonia, maintain swallowing muscle strength, practice swallowing, and maintain adequate hydration. What are the risks? All studies published to date have not implicated any increased risk, high benefit with little known risk. And these are my references.